Thank you, Sally. This is Mary Hart, Director of Research for Allergy and Asthma Network, and today we're going to be looking at 5 things to know about the important role of the asthma educator. And our 5 Things to Know webinar series is presented by the Allergy Asthma Network to share thoughts about issues that are important to patients and healthcare providers. So the 5 things to know today are the important role of the asthma educator, telehealth for asthma educators, navigating severe asthma, certification, and tools for asthma educators. And so I'm going to be looking at these topics through the eyes of my experience as a respiratory therapist for many years, as well as an asthma educator. Teaching people to manage their asthma is one of the things that I find most fulfilling. And I'm very proud to be part of the Allergy and Asthma Network. And this year we're celebrating our 35th year of supporting patients and families. We're a grassroots patient advocacy organization with a mission to end the needless death and suffering due to asthma, allergies, and related conditions through our outreach, education, advocacy, and research. And we do this by working with experts in the field of allergy and asthma. And today we have an expert here to talk about the important role of the asthma educator. It's a topic she's very passionate about. And many of you already know Dr. Karen Gregory. She will be joining me today, and she's an acute care advanced practice nurse with a specialty in asthma, allergy, and pulmonary medicine. She's a registered respiratory therapist and has been a certified asthma educator since 2002. Dr. Gregory is an advanced practice provider at the Oklahoma Allergy and Asthma Center in Oklahoma City. She's also an assistant professor at Georgetown University for the School of Nursing and Health Studies. Dr. Gregory holds active memberships and leadership positions in multiple professional organizations, serving on boards, committees, projects. She serves as a chair for the American Academy of Allergy, Asthma, and Immunology Allied Health. She's an active member of the Association of Asthma Educators and American Association for Respiratory Care. She's past president of the Association of Asthma Educators, and her clinical interests include asthma disparity in the Medicaid and rural populations, severe asthma, autism and asthma, and enhancing the immune system to improve asthma outcomes. Dr. Gregory, she lectures on issues related to allergy and asthma and disease management, and she's published in these areas. So Karen, you're up first, and we're
Okay.
really looking forward to what you have to share.
Thank you, Mary, so much. And I want to thank the Allergy and Asthma Network for inviting me to be a part of this amazing presentation today. I just love it, and I love the 5 things we need to know. Well, first of all, I hope you all enjoy this webinar. First of all, asthma educators have a very important role. We play an important role in schools and in communities. We're great at teaching and counseling and educating our patients with asthma and their families. We teach them how to manage their disease or their chronic illness and how to reduce preventions of exacerbation. And this really are what we strive to do is impact their quality of life or improve their quality of life. So today we'll be talking about things we need to know about our role as asthma educators. So if we stop and look at asthma, we see there are over 25 million Americans diagnosed with asthma. 1 in every 10 child has asthma. We see that it's a significant disease burden with major health consequences for adults and for our children in the United States. In the United States, we spend about $80 billion on annual costs, direct and indirect costs. I believe that no patient, we should do everything possible. No patient should be dying today in 2020 of asthma. There's about 3,168 deaths annually from asthma. Unfortunately, we had one in our area, not too long ago, and it was needless. 75% of deaths are higher in Black persons than in white persons. 13.8 million kids miss school every year, and asthma is the #1 reason why kids miss school. 14.2 million missed work days, limited in physical activity. That's important that we, as asthma educators, that we ask about if our patients have any limitations. But 3 in 5 of patients with asthma will tell us they're limited. 71% misuse inhalers. If that doesn't speak to why our country needs asthma educators, I don't know what does. 71% misuse. We can give them the best prescriptions, the best evidence-based practice medicines, the best, but if they don't know how to use it, it's not effective at all. And sadly, 1 in 5 cannot afford medications for their asthma. So let's look about what is asthma understanding. As you know, each person with asthma is unique to them, has a unique responsibility unique disease. Asthma is not just a single disease, but it's a series of complexities, heterogeneous disorder, and we see overlapping diseases, individual diseases and phenotypes. Asthma is a syndrome rather than a single disease. There's some unique interactions between genetics and environmental factors. The guidelines, national and international, speak clearly to this. But what we see is inflammatory responses. Asthma is a chronic inflammatory disease that's characterized by clinical syndromes of bronchial airway hyperresponsiveness. Then we can see the arrow pointing at the bottom to clinical symptoms: coughing, wheezing, dyspnea, shortness of breath, and then reversible obstruction. So we just said 71% of patients with asthma do not know how to use their inhalers. So we are critically needed in this country. But who is the asthma educators? I bet everyone here today is an asthma educator. So an asthma educator is an expert in counseling individuals with asthma, in educating and counseling their families, and how to manage their asthma and minimize its impact on their quality of life. They serve as resources to the community, and they provide information about asthma. I think asthma educators are always are reading in the current literature, always reading, always learning. The literature does clearly describe that asthma education improves clinical outcomes. And another thing, asthma education is recognized as the fundamental basis for asthma monitoring, for symptom control and treatment. So as an asthma educator, as we all are asthma educators, we possess comprehensive current knowledge of asthma because we're always diving in the literature, looking at what is up and coming, especially now with COVID-19. We understand pathophysiology, management and development, looking at cultural dimensions. How does it impact the culture? And the impact of chronic illness. Having a chronic illness leads to significant problems and challenges. And then principles of learning. The asthma educator knows about objective and subjective evaluations, so we're able to bring that and present that, lay that on the table, and teach our patient. So who is eligible to be a certified asthma educator? That's what I love about the asthma educator's credential, is that it's a diverse group and we all need each other. Physicians, physician assistants, nurse practitioners, nurses, respiratory therapists, pulmonary function technologists, pharmacists, social worker, health educators, physical therapist, occupational therapist. So the asthma educator has a comprehensive and current knowledge of asthma pathophysiology and development and human development. They understand asthma diagnosis and treatment. They can teach patients, or I should say, we can teach patients signs and symptoms of worsening asthma, how to identify when your asthma is not under control. Asthma educators teach medication action use and asthma action plans. Asthma educators help implement an asthma action plan using an individualized approach. And asthma educators also serve as a patient and community resource. We were talking earlier, it's so important for school nurses. We need them so much, especially now with the pandemic and the crisis that we're all in. How is this stress exacerbating asthma? And our students, those who go to school, we need our school nurses. We need them so desperately, especially now. So, where does the asthma educator practice? You will see asthma educators all over the place. We see the asthma educator in hospitals, at the bedside. I know I have colleagues, respiratory therapists, asthma educators that are teaching, asthma education in the emergency department. Clinics. I'm in an outpatient clinic, and we do extensive asthma education. And one thing why I'm thinking of it with asthma education, we do need to implement return demonstration. I don't want to forget and leave that critical point out. We can talk to our patient, but they have to. We need to ask them for return demonstration. Pharmacies. Our PharmDs are rock stars at asthma education. Who better than a pharmacist to know, as they're and especially in retail, picking up their medication, the patient picking up their medication, and the patient not having a clue what it is, not even just other than knowing the color of the inhaler. Schools, again, school nurses are near and dear to our hearts, and we can't live without them. Telehealth, we're going to talk about that. And then anywhere people who need education. So let's talk number two, telehealth for asthma education. I am so excited about telehealth for asthma education. Asthma educators can use telehealth to access, evaluate, and educate patients. So it is time for telehealth. Changes in the way healthcare is delivered now during this pandemic are quite an adjustment for the entire world, especially our healthcare system. We have to look and be really thinking outside the box. We have to adjust to the new way that I hear it called the new normal, but we have to adjust how we're going to assess, evaluate, and care for our patients using evidence-based practice. We need each case of asthma of patients with asthma is unique and individualized. We must implement an individualized approach. Patients need asthma management, what that works for them. You can have, okay, let's administer your medication at 7 o'clock in the morning to a mom who has 3 kids. She has to get to school, get to work, all this. Well, that's not going to work for her. So it has to be an individualized approach. And oftentimes when they're in their home, it is so awesome because you can just they seem to be, in my opinion, more relaxed, and they can talk to you about, no, this is what I do. This is what, it's just more of their environment, but where they are and when it's convenient. I find telehealth visits are great solutions for treating asthma because it can be cost effective. It limits, helps eliminate travel. In our practice, we see a lot of um, rural or patients who live in rural areas, and they could be, have a 5-hour drive one way. um, I like to have patients when we're talking grab their medications or let me see the condition of their valve holding chamber. See, hey, you can wash that thing. It's not supposed to be all cloudy and white. But if we look at all the benefits of telehealth are limited, or they're unlimited. The access, the ability to increase care access for all patients population and decrease the barrier. Like I said, another barrier would be childcare for younger siblings and scheduling conflicts. That's very, very good. But what I've learned in our telehealth since the pandemic is that people are so afraid. Some people are so afraid of parents their children contracting COVID-19 and then them have a fatal outcome. So it does minimize the risk of the virus exposed to patients who are very vulnerable, and it also and healthcare workers. If frontline workers, we have to keep them safe and as healthy as can be. The literature does show delivering asthma education via telehealth is well received. Some patients may not be able to adapt to the technology, but if with confidence and encouragement, they can easily learn. Um, Patients who are again vulnerable, that can really help. And the good thing, telehealth does protect patient privacy and personal information. And then there are benefits with children with asthma. Again, they can grab their inhaler, you can meet their best friend or their favorite toys and all of that stuff. So it makes it very the lifestyle interventions too we could talk about. And another benefit I didn't put on here, but insurance payers and healthcare professional associations are supporting transition to telehealth services during this pandemic. And I know some of the government insurances are really loosening their regulations for telehealth in response to the COVID-19 pandemic.
Hey, Karen, this is Mary. Could I interrupt you for just a
Oh,
second?
please do.
I, ju- I, I just wanted to say something to that point that respiratory therapists, CMS has recently approved for respiratory therapists to be part of telehealth. So I
Oh,
just wanted to, if they
thank
haven't
you.
read that yet, yes.
Thank you for saying that. Oh, that is the best news that respiratory therapists are approved. That is excellent news.
Hmm.
Thank you so much. So telehealth and asthma coaching, it makes it more convenient for you to show up for your appointments. It provides you with the tools that you share data, lifestyle habits. Show me the lunch you're eating right now. It may not be the healthiest of ever, and it just seems like in my experience they're so relaxed. They're at home. I mean, I have patients, eating lunch, and I'm asking them to open their mouth and let me see their throat and all this stuff. So they can show me where they run outside and in it, and they can show me their room where they sleep, and all those can be teachable moments. So it's very, very exciting. It also enables healthcare professionals to easily refer to asthma or food allergy coaches, dietitians, or other support. COVID-19 and telehealth. COVID-19 has immensely hastened the acceptance of telehealth. Mary just told us that respiratory therapists are now being reimbursed, but the coronavirus disease pandemic is very scary for people, especially those with asthma. They have a fear of worsening, outcomes because of the COVID-19. So it's important to know there is currently limited evidence about the significance of infection rate with asthma, but the CDC has published numerous things on this. But we still worry about moderate and severe asthma could be at greater risk for more severe disease. But with COVID-19 and telehealth, we can safely visit the provider and the asthma educator with social distancing. And our opinion and the opinion of the Allergy and Asthma Network, telehealth is fortunately here to stay. Some programs that are available: asthma coaches are certified asthma educators with the Asthma and Allergy Network. So telehealth programs for the Allergy and Asthma Network, their asthma coaches are certified asthma educators with additional license as a respiratory therapist, pharmacist, nurses. And these coaches are allowed or follow the validated PRIDE program that was developed by the University of Michigan Center for Chronic Disease Management. It's an excellent program. I can attest to that. It implements asthma management using proper inhaler technique, how to deal with environmental triggers. I know if your allergies are controlled, your asthma is better controlled, and then how to keep your asthma under control. And you get to see this, you're right there in their home. You can see exactly, you have so many teachable moments. The coaches are motivational interviewing and share decision making to support behavior changes for you and your family.
Okay, thank you, Karen. I'm just going to take a little time to talk about navigating severe asthma and the role of the asthma educator as an asthma navigator. So the first thing we want to talk about is severe asthma and what it is. And it's despite everything that you've done, it requires high-dose inhaled corticosteroids, plus a long-acting beta-2 agonist and or additional controller medication, or sometimes requires oral corticosteroids to prevent it from becoming uncontrolled or remains uncontrolled despite any therapy. And as we know, 5 to 10% of our asthmatics have severe asthma, and we need to recognize that not all uncontrolled asthma is severe, and not all severe asthma is uncontrolled. And as an asthma educator, we all have our group of patients that no matter what we do or what we
Yes.
try works, right? And so factors that may play a role in asthma and severity and those treatment options that we could ask ourselves would be to evaluate, like she said, inhaler technique. As Karen mentioned, 71% of them can't use their inhalers properly, as well as medication adherence, allergen avoidance, stress, and not just now, but all the time. There's all this access to care and treatment. 1 in 5 patients can't afford their medications. And with severe asthmatics, they may need additional type treatments based on their phenotype and biologics and possibly even bronchothermoplasty surgery. So as we know, our patients show up in the emergency room at high rates. They get hospitalized, they miss more school, they miss more work, and that oftentimes they find that they can't even do the simple activities of daily living. And we've all met those patients that come through the ED. And many of them just need education to adhere to their medications or to gain access to care and to treatment. A lot of them use the emergency department as their primary care physician. And so sometimes what we can do as asthma educators is to train and empower them in self-management. However, there is that group of uncontrolled severe patients that live in fear of the next exacerbation, and that anxiety and fear and stress, it's all part of their day. And it creates this vicious cycle that, that lands them right back in the emergency room. And I just want to say, not only do they have to deal with that shortness of breath and inability to do the things that they enjoy doing, but the emotional side can have an effect on them even going to school and work and maintaining a job. So there's a stigma around people that have asthma. And I've talked to patients that are completely embarrassed from coughing too much in public, having to use their inhaler, as well as the shortness of breath they have when no one else is short of breath. And they think that sometimes people think that they are lazy, they're pretending, they don't take care of themselves. So how can we as asthma educators help them? And on this slide, we have 4 different things there listed. Navigate healthcare system. And that's a very big issue for patients, especially now. And in regular times when most our patients either had insurance or Medicaid or something, where we now have this gap of patients that no longer have jobs or access to insurance. But we need to do our best to try to address the needs that they have to gain access, and then by helping them navigate through the system. A lot of asthma patients have comorbid conditions, and they may need allergy testing, they may need to see an allergist, atopic dermatitis, and we can help them find out which doctors they need, what type of therapy they need, and make it a little more accessible to them. And for those that don't have health insurance, this becomes even a greater problem. So having resources to share with them is very important in helping them manage their asthma, letting them know that there are community clinics and services available in their neighborhoods, patient assistance programs that can be found online, showing them some of the pharmaceutical companies that they can apply for and get the medications that they need. And even referring them, we used to work in our group, in our outpatient lung center, we had social workers and case managers and clinics where we all partnered together and that was part of the navigation that we did in trying to help these patients. And sometimes it's just knowing how to fill out a form, and it's nothing too small like that. It's a big help for our patients. So, okay, number 2, help the patient know what to ask and how to communicate and when to ask it. I know that patients talking to physicians, they're talking about test results and their diagnoses and medications, changing medications, options for medications, and the patient just sits there. They don't know what to ask, and then they leave there confused. Maybe they're embarrassed to ask questions, I'm not sure, but they can't expect us or our healthcare provider to be able to read their minds, right? So some of the things that I've talked to patients about is like shared decision making, asking questions about, well, if I take this medication, what kind of side effects will I have, or what's possible? How much does it cost? Can I afford it? Are there other options? So they should be a part of that. And I'm just going to share a very quick little snippet story there about that communication. We had a patient that came in. She was newly diagnosed with asthma. We taught her how to use her inhaler, gave her a prescription, asked her to come back in about 3 weeks so that we could evaluate the effectiveness of that. And she did what she was supposed to do. She came back, and when asked about her medication and how she felt and all, she said, I didn't take it. And we asked her why, and she said because she didn't understand what BID meant. So we failed as educators there. So the next part of that, providing basic and enhanced asthma education, that's where we as educators have to think back on we have to look back on how we actually train patients. Do we use individualized care, that we teach them the basic asthma education, but think about what we're seeing today in terms of what people can find on the internet, social media, friends, TV. So we need to make sure as asthma educators that we only offer credible information and that it's evidence-based. And then it's at a level that the patient can understand, and that there's lots of different ways to provide this material. And the last thing, help the patient live their best lives. Think about it. If we can help them gain control of their asthma and enjoy life, that would be the best gift for both of us. But I always try to find out too, what do patients enjoy doing, and do they have a goal set for doing something, and then help them meet that goal, such as going on a family vacation. So I just want to share quickly a personal experience that I had with my team at Baylor in Dallas. And the reason we were able to do this Navigator program was because of a grateful patient who funded a 2-year pilot project. And it was an inpatient and outpatient hospital project on adult patients. And we were looking at our high-risk asthma patients who had been admitted or they had multiple emergency room visits. And the way that we did this is we had one of our respiratory therapist, asthma educator, certified asthma educator, focus on nothing but this program. And they were called as soon as that patient was admitted. So if it was on a Friday night, she got a call. She had to be there within, I think it was 24 to 48 hours. So we worked really hard with that. But that gave us an opportunity to begin working with that patient at that time and bond with them before they left the hospital. Because if you think about it, most patients are only in the hospital for 2 to 3 days with asthma. They get out of there, they get to feeling better pretty quickly, and they're out of there. And so what she did, she connected with the patient by doing an assessment, evaluation, offering education. And what we offered the patient was actually an asthma toolbox that they would use there while they were in the hospital and ask questions. And they would have their peak flow meter, a chamber, an asthma action plan, a booklet. And they left there with an appointment to visit our center after they were discharged within that week. So there's lots of hand holding at first. You have to build that trust, then the confidence comes and they're empowered. And with severe asthma patients, there's much more time and attention needed. In fact, I often tell people don't become an asthma navigator if you can't be a patient advocate. So something else we learned was something as simple as identifying triggers and allergies testing would make a big difference. One of our patients in this study had never been allergy tested and found out that he was allergic to all kinds of plants and trees, grasses, everything that's outdoors. And come to find out, his job was picking up trash on a busy freeway in Dallas all year round. So if you know Dallas, we have hot days, cold days, lots of exhaust. So he was up against a horrible, environment there. So having an asthma educator, navigator, working with a multidisciplinary team of, like I said, case managers, pharmacists, clinics, it all helps reduce exacerbation and improve quality of life in patients. And under our results, one of the things that I'm most proud of is that they didn't have the in a year's time, these patients, and it was a very small group of patients, didn't have any emergency room visits, oral corticosteroid use, and they were able to continually verbalize asthma control methods, and it showed from the way that they were treated. And if you go ahead and on the poster that we have, I just have that not for you to read or try to grasp anything out of it, but I included it because I think that it's important that I just want to encourage you to write up your stories, your success projects, your quality improvement initiatives, your research as asthma educators, and present these places. We learn so much more when we're networking, and that's how we grow. So with that, Karen, you're up next.
Oh, great. I love that. Wow, that's a very, very impressive poster, and what a great study. And a patient funded that. Is that correct?
Yes, yes. The
Wow.
patient, this was a patient that had, he was an adult patient who had been hospitalized and didn't know what was going on. They said, well, you might have asthma. And then he was then referred to our clinic. And in our clinic, he gained a diagnosis, of treatment, and the education and the care that he felt like was superb. So he wanted to do something so that other people could receive what he received in terms of getting that referral to a clinic to get help rather than just go home with a bunch of medications and not know what to do.
Right. Uh, Wow, what an amazing person, but what a great opportunity
I,
and what great outcomes.
yes, yes.
So now let's talk a little bit about the Asthma Educator certification. If you're not already certified, here is where we go to find more information. So the National Asthma Educator Certification Board was founded in September 2000, and it's a professional certification organization, and it acts in the public interest, just like other certification bodies do, establishing and enforcing education, examination experience, and ethical requirements for certification. The first test was administered September 19th, 2002, and I need to stop and say that Mary Hart served on this board for a long time. So that was very, very grateful. So, the NAECB exam is a voluntary testing program used to assess qualified health professionals' knowledge in asthma. I think personally, it's kind of a tough test. It's not just, oh, I know a little bit about asthma, let's go take this exam. The passage rate is I think 68-ish, around that area. So it is good. It's an evaluated process that demonstrates rigorous education and experience requirements have been met. And again, the certification is voluntary and not required by law for employment in the field, although some agencies may use this AEC certification as the basis for employment. I know it could be some jobs you may have a promotion or even a salary increase. Some places, our clinic will pay for people to take the exam if they pass. The exam, that's composed of 175 questions, 150 scored questions, and 25 of those are pretest questions. Who's eligible to sit for this amazing exam? There's two kinds of eligibility. The candidate must fulfill one of the requirements. So you can either be a licensed or credentialed healthcare professional, that list that we talked about earlier, the physician, respiratory therapist, pharmacist, nurse practitioner, or you can be, and we do have some of those across the country, individuals providing professional direct patient asthma education and counseling within a minimum of 1,000 hours of experience. And this has to be documented experience in these activities. So they have to document that there is 1,000 educational hours. And there are a lot of people who pass by doing by this type of role. So what steps should you take if you want to take the exam? I really encourage you to take this exam. You visit the naecb.com, click on certificates. You can go to get certified. The handbook, I recommend you print the handbook, copy the handbook, and follow the matrix 100%. I would read it to its entirety.
Okay, so thank you so much for that. That's great information. And I'd be sure guys check out that website too and see what all they have to offer. So I'm going to quickly go through the rest of the presentation here, looking at asthma educator tools. There's nothing better than having a variety of tools available. And I remember when I got my first poster that had all of the medication delivery devices on it. I thought I was in heaven, right? So this is our new face, the Allergy Asthma Network. Allergyasthmanetwork.org is our website, and we have, I look at it as the home for everything that you need to know about asthma and more. We just have gotten a few of tabs listed and highlighted there. Under asthma, it's asthma A to Z. Under severe asthma, one of the things that I like to use when I'm teaching and talking to a patient is that chart on phenotypes in the treatment. And when we talk about, what can make a difference and really support a patient that has severe asthma, knowing where to go with that. And then telehealth, Karen has already hit on the Allergy Asthma Network's Asthma Coaches Telehealth Program. All of that's there for you. There's much more about other conditions that are related to asthma and allergies. Our website's like a one-stop shop for asthma educators, so visit us there. And then another website, or if you're not familiar with it, it's the Association of Asthma Educators. And one of the things that I've found delightful, I'll just put it that way, is that under their About Us tab, they actually have a list of active members. So you can network with other asthma educators and get advice and share information. It's about $80 to join for professionals a year. They're having their virtual meeting. I believe it's September 25th. Of course, all the meetings this year are virtual. And if you're thinking about becoming an asthma educator, or you need to recertify, they also have a virtual course in September 18th and 19th. So on about the posters, go ahead and there we go. With the posters, we have our updated 2020 poster. If we have any more medications, we're going to have to go to either much smaller images or a bigger poster. These are so good to use with patients. I've always used mine at the bedside or in the clinic. We have one now that's laminated to where it has an asthma action plan on the back. So it's a great teaching tool while you've got their patients. And people think about, Well, you only use them when you're at the patient's bedside. Well, I used mine when I was in research going over when you do clinical studies and patients have to tell you what medications they're on. They don't always remember those. And then we have a new poster, respiratory tools. And then following that, infographics, you all know that we have Allergy Asthma Network, not only with the webinars, but we've really been busy keeping up with what's going on and creating information that people can use. We have worked with our experts in following the CDC to keep our network up to date. And then you can also find information about COVID, even a poster. It's called Asthma Care at Schools post COVID-19 outbreak. You know, like, how do you know if it's asthma or if it's COVID or if it's the flu or anything else these days, right? But please continue, we're going to continue to produce information and share as much of it as we can on our website, but also check out our social media for updates. And then we have understanding asthma guides. We have understanding allergies and atopic dermatitis and much more. These are specifically for patients. They're great training materials, but I also find that using storytelling or storybooks is a good way to connect with kids because they can relate to the pictures and the kids in these books to help them learn more about asthma and control. We have those in our store online as well. And then uh, one other thing that I wanted to share with you is an app that I have found to be great when working with asthma patients. It's called Asthma Storylines. It allows them to journal their asthma. It's free to download. And it's adapted for all types of smartphones, tablets, and so forth. But it helps track medication use and symptoms and peak flow, daily moods, surveys. There's so much on that. And the patient can then share it with their healthcare provider. And then we also have patient learning pathways. So if you talk to a patient and they still want more information, uh, show them our website. These are PowerPoints that have audio with them, and they can learn more about their asthma as well as their asthma medications. So I guess we're at the point where we need to ask some questions, Karen. So
Okay.
let me take a look here and see what we've got started here.
I
So
have
I'm going
not.
to add,
Oh,
uh,
I
um,
I haven't seen that that amazing or infographic of asthma care at school. That is awesome.
yes, and it's on our website. That's all of that information and more is there.
Perfect.
Thank you for that. So I have a question. One of the questions that came in says, um, how do asthma educators intersect with public health in their communities? Do you want to
Um,
take that one?
sure, sure. So public health, looking at, I think public health it focuses on the, other, sometimes I get tunnel vision. I think only thing going on, especially like with school nurses, they don't have diabetes, epilepsy, seizures, anything else. They just have kids with asthma. So not true.
Mm,
Public health the same way. They look at the bigger picture where an asthma educator can come in and help be the specialist or the expert in asthma management or asthma, out clinical improving their clinical outcomes, and just play a big role with help managing disease severity, lifestyles, things like that. Just a really community thing. What opportunities does the community have? Now there could be virtual gatherings of an asthma education day or an asthma champion day, a lot of things that the asthma educator could recommend to the public health professional.
yeah. And so I was just going to say one thing about that too is that I've been lucky enough to work in different communities, training the community health workers as part of a public health asthma campaign that they had going on. And also, like you said, through the schools, working with school nurses and school staff. Um, so another question, what kind of feedback do you get from patients about telehealth? And I'm going to let you answer that one too, because you
Uh,
do the telehealth in this group.
well, thank you. But I see it more as a positive, positive thing. There, I mean, there's challenges like frustration with technology, or you know, sometimes I get dizzy because the phone's moving. It like they're running all over the house, and you get a little dizzy. It's kind of like a roller coaster. But the best thing is that I think they love it. I think they love it because they're in their own comfortable environment. They can talk to you. You know, they are on their in their playground. They can talk to you, you know, about what problems they have, show you, you know, problems in the home. They can show you what their valve holding chamber looks like. I think it's better a lot. And then that too, transportation is you know that it removes that barrier of transportation, and then also the barrier of fear. There's so much fear with this pandemic.
Yes, thank you. That's a good picture of what it might look like, what it might sound like. And I think that regardless whether people like it or not, telehealth is here to stay.
Mhm.
COVID just propelled us into it sooner, right? Sooner than
Right,
later.
right.
Okay, have another question. I guess both of us can answer this one. Do asthma educators intersect with school nurses, and how do they collaborate? I'll go ahead and start with that one. In working with the Allergy Asthma Network, we have the opportunity to going to different states and work with them with their stock albuterol policies and um, training on different devices, including EpiPens. It's usually the way that we get involved and the way that I've gotten involved, even from a city, a Dallas level, is contacting the school, the independent school district, and going through their director of nurses, and then going through each principal in those districts. It can be a very difficult process. Maybe that's why this question's being asked, but once you get your foot in the door, they recognize how much you have to offer and how much they can gain and from that. Offering programs to the schools will also help. Speaking at I'm old, so I call them PTA meetings, um, to parents also help, you know, spread that asthma education beyond just the school walls. Doing asthma programs like one of the ones that we've done here in Dallas was an Art for Asthma program. We did an asthma camp that was strictly directed at kids in the inner city. So those are all ways that asthma educators can work with school. And I have a friend that's an asthma educator that worked directly with the school and all the school nurses. So Karen, do you have anything else to?
That is good. I know this time of year, the schools that are open, if you work in a clinical setting, you may be having to permission to administer medication at school, and that's a good opportunity to write that asthma action plan, or get that, you know, maybe put a note there. If the school nurse has any questions, please call, you know, whatever. And then just take those teachable moments. You may have to look for them and grab them, but take those teachable moments to you know, for the school. And then if you do work in a clinic setting, or a hospital setting, if they're in there, you could say, you know, like, what are you going to need for school? What can we do to help you? Have your school nurse call us if it's okay. You know, no, not you know, not breaking any HIPAA rules or anything, but just for basic education. And then, like Mary said, going out to the schools and if you can, face to face or virtual. You know, you could do a Zoom asthma day or something. You know, celebrate asthma
Mhm.
and celebrate knowledge and celebrate education.
Yeah, and I was just going to add one more thing to that. My daughter is a is a teacher in a high school, and I don't know about you guys, but getting high school students to participate in asthma education, or even acknowledge that they have asthma most of the time is very difficult. But there was a group of students there that were working on a project, and part of what we did was go in and train students that were, we trained the trainers, basically, students that then went out and talked to kids with asthma their about their asthma and asthma control and so forth. And so that was a great opportunity. It was asthma educators were there to help guide them when they got stuck with questions. So just be creative. Sometimes that's what we
Yeah.
have to do to get involved. Okay, and there's one other question here. We've got, I think, time for one more. What is your opinion of the albuterol click versus the standard inhaled albuterol device? Do you have an opinion, Karen?
Um, you know what? Bottom line, it's what does the insurance pay for? Wouldn't you think? Yes, what does I have asthma and I have the Respiclick because I mean, that's just, I'm not promoting either one, but I like it. You don't need the valve holding chamber and it's easy to do. You have to have a good inspiratory flow rate, but it just depends on what insurance will pay for, what the person's insurance will pay for. Is that what you think,
Yeah.
Mary?
Well,
Okay.
I think that's a big part of it, obviously. And then the second part of it is, just having a different device that patients have a choice of one over the other in terms of what they like to use. I mean, some people like the old style and they're not going to change and they don't feel like they get anything out of that other one. And, I don't use my chamber with that. What's up with that? So, I like having options myself
I do too.
and then going back to what's covered under their insurance and what's the least expensive for them. Okay. So I just want to thank everyone for being with us. And Karen, thank you so much.
Thank you for
This was
inviting
really
me.
great.
I love getting anytime the opportunity to get to share the podium with you.
I feel the same way. We just go back and forth.
Yes.
Um, at this time, then please download the certificate from your control panel. It can be found in the handouts pane on your GoToMeeting control panel. Please do that right now as it won't be available when the webinar closes. You can print that for your use. And as a reminder, continuing education credits are not available for this webinar. If you have any difficulties, please email us using the link in your emails. And I just want to thank you for joining us today. And I want to especially thank Sally for making those cute little avatars. They kept me laughing
Yes.
the whole time.
I love them.
And so this is Mary Hart, and for the entire staff at Allergy and Asthma Network, we hope you've learned 5 things about the role of asthma educators.